Hello, I'm Dr. Brandt Gibson, and tonight, or this afternoon, or evening, however you want to say it, I want to talk to you about nerve repression, managing your peripheral neuropathy through repressing the symptoms of the nerve or the neuropathy. A lot of times I've been pretty vague and kind of talked about this and talked around about, but so I want to make it a little bit clearer right now. There's three areas, three different pieces of how you can manage peripheral neuropathy symptoms through repression. So one of those is physical items. So most treatments that we see with nerve repression, that's what they're doing. They're actually doing a physical treatment. That includes some forms of physical therapy where they can actually do things to actually decrease symptoms. That includes TENS units where you can actually physically wear and use a TENS unit and it will decrease symptoms by overpowering the nerve. That includes many of the topical treatments, topical lidocaine, capsaicin creams, some of the doTERRA oils or Young Living oils where you can actually rub on and they'll actually decrease it. Even some of this CBD type treatments are all physical products that can actually be used to repress the nerve symptoms. Number two is, actually, I should include in that, of course, the medications such as Lyrica and gabapentin and Cymbalta. All of those are designed not to fix anything, but they repress the symptoms. They stop the symptoms. Number two is there's a physical way that you can actually do something. You can do things to repress the symptoms. Some of those kind of things is exercise is a very, very powerful tool to repress nerve symptoms. And so exercise is one of those, massage is one of those. The idea is you're repressing nerve symptoms by doing those activities. Number three, the third thing that we do is using the power of the mind. And this is one that most people have a hard time with. So I'm going to go into a little bit more depth in some of these to kind of help you understand how that works. Number three, of course, is using that mind. So what are some of the things that can be done with using the mind? There's a process called anchoring where you can actually create a trigger point that if you utilize it will create certain symptoms. So you say, I want to create happiness, or I want to create joy, or basically stimulate certain memories by using a trigger point. This is called anchoring. And as you use anchoring, it can actually be used in times when you're having significant symptoms, significant pain. And through anchoring, you can actually make it so that these symptoms improve. And that's kind of the idea of that. You've got neuro-linguistic programming, which is basically a process of talking to the mind and actually focusing and working on that pain neuromatrix and teaching it through certain processes to perceive the symptoms or perceive the pain differently. Number three is self-hypnosis, which is a very specialized form of neuro-linguistic programming. We're actually talking directly to the brain itself. Through self-hypnosis, you can actually change things, change symptoms, change things right in the process of when it's really becoming problematic. The third one, the next one we want to talk about really is a process called unhackability. And that it's a unique way where you're actually going, okay, I'm going to take my symptoms and I'm going to move from distraction, discomfort, and disability to full functioning, to functioning at the highest superhuman level. And this is through a process of using these principles that are taught in a book, Unhackable here, where it actually talks about each of those very, very important principles, including flawless idea, anatomy, deliberate magnetic focus, and optimal human performance. And so you're basically saying, okay, through these three steps, you're able to take back control of your mind, take back control of your body, and ultimately take back control of your life. So through all of these processes of repressing the symptoms, it allows you to have tools that you can utilize when some of the other treatments, some of the things that you're doing to re-educate the nerve, reset the nerve, or repair the nerve are not completely functioning. So these are things that I think we should recommend, that we should actually talk about. This is Dr. Brandt Gibson, and this is your Neuropathy Nugget, day 207. And that is repression of nerve symptoms through specific techniques. This is Dr. Brandt Gibson. Have a great rest of your day.